Okay, welcome to the Board of Health meeting. We'll start this meeting at 10:02. Everybody ready? I think first of all, the minutes have been passed out. Did everybody have time to receive the minutes? Is there any last minute corrections? I'd entertain
I'll
a
move to
motion.
approve the minutes.
Okay. We have a motion on the floor to approve the minutes from, what was that? The January meeting minutes of January 30th. All in favor, say aye.
Aye.
Aye. Looks like it was unanimous. Any opposed? Okay, so the minutes are approved. That was nice and easy. We had a cancellation on the agenda today. We were gonna have the school coalitions coming in, but the person who was gonna give the presentation is ill, so we're gonna put that off and invite them to come back another day. So moving on, we have the next item is the health officer discussion. And we have put out an RFQ, which is a request for qualifications. That period has ended. And we have an applicant that applied and wanted to see if anybody had a discussion to discuss this. And then I believe, did we get a resolution, Carol? We have a resolution somewhere? We don't have it printed, but we have a resolution for that. Oh, there she comes. Thank you. Sorry, we jumped right into it too quick. Commissioner Martinson, did you want to say something?
Yeah, actually, I do. In the early goings when we were trying to investigate what it is we should do for a health officer and the concerns we had about the previous arrangement of health officers, there was a fair amount of what I would call exaggeration and misinformation. We were leaned upon, all of us, rather heavily because we thought the world was going to stop because no death certificates would be issued, anything like that. Well, it turns out that that wasn't true. And the death certificates themselves predominantly come through either the coroner or the attending physician. And only when the attending physician refuses to sign a death certificate, which you might want to ask something about that, but in any event, ignoring that, then the health officer may step in and sign a death certificate. So the fact that we, for a few days, did not have a health officer was not the cataclysmic problem that people try to make it out to be. That allowed us the time to think about what it is we wish to do. And certainly the board, the previous Board of Health, which is the BOCC, and some others had some concerns over the previous arrangement we had. And that gave us time to talk with Dr. Krager, and I got to discuss things with Dr. Krager in a very fruitful one-on-one kind of thing that actually is productive. And we're here today ultimately to approve an annual contract to have Dr. Krager be our health officer. We, in many other venues or in many other situations in the county, find a problem when we only have one single respondent. And that's always something that we have to be concerned about. And we should look for people to be interested in the job, and somehow they're not. And we should find out what that is. furthermore, in the discussion about the health officer, it's what duties exactly does a health officer do? And we're struggling as a board to try, or at least I am, trying to figure out what the obligations are of HHS versus the health officer. I recall when Dr. Melnick and Dr. Krager first came on board, that they were put under some pressure to decide that Camp Alabama was a health hazard and the health officer was supposed to declare that. And of course, the health officer has a lot of power. So that requires a lot of wisdom and reservation on the part of the health officer, which should be a totally non-political position. And fortunately, I think that's something we can have confidence in with Dr. Krager. The function of the health officer is not the same as HHS. And I think sometimes they're conflated. We think things that are epidemics, well, I would divide them out into a categorization that says, let's say tomorrow there were an incident of Ebola in the county, and maybe the following day after that, there were 3 times as many people succumbing to Ebola or becoming infected. That is the kind of epidemic where I would expect the health officer is going to be right on it and saying, okay, we have to do something about this. But when we misuse the word epidemic for things over which, like epidemic of fat people, present company excluded, of course, we should make a distinction between that where an innocent person is going to be impacted and that where a conscious person does it to themselves somehow. And we don't make that distinction. I think for the things that HHS should do is much more of disseminating information. You cannot mandate people not to have French fries at McDonald's. And that's the distinction I'm trying to drive. So we very much don't mind having a health officer, but we must work with the health officer in appropriate context. The issue on the contracts now, I guess on the resolution, I should look at it. I think I've seen it before. Yeah, in the RFQ, there was an offer of a dollar amount for the contract. I don't know if we want to discuss that or not. I typically am not in favor of discussing remuneration too much because you can be penny wise and pound foolish easily. It is important though for me to put things in perspective, like based on the data I had before, it looks like the health officer gets paid about $190 an hour. And so in the case that there is an epidemic of a Ebola kind, I'm sure $190 is okay. If it's just a sinecure, maybe it's not okay. The board will have to decide what the recommendation is to the BOCC on that. I have a feeling I've skipped over a couple of things, but I'll stop here.
Anybody else on the board have a comment to add, or Gina?
The comment that I wanted to make twofold is I'm pleased that Dr. Krager is willing to serve as our health officer. The salary and figures are at the discretion of the Board of County Commissioners, not this board. We get to a point, but paying him is that's the financial thing that the board will have to work out through our staff, which probably has already been done. I appreciate the resolution that kind of sets out the requirements for being a health officer. And particularly the references to state law that he can only do what the state law allows him to do, but there is an important grant of emergency authority as is needed. So I'm glad to see us at this point where we can call on Dr. Krager. Do we need a motion at this time?
Before that, I do remember, but I forgot, there was one key issue, which is the constructs from the legislature are always going to be a bit bizarre because it's put together by a bunch of people who I won't go down that route at the moment, but if we look at this RCW itself, it states that if our health officer is unavailable, the regional health officer can help us out. So if you look at things, it's a hierarchy. There's the state board of health, and there's a county board of health. Somewhere in parallel around there is I don't know, is there a state health officer? There's certainly a regional health officer. And then there's a county health officer. The purpose of the regional health officer in the RCW, you can infer, is because health officers do go on vacation. Health officers may become temporarily unavailable. So a backup situation has to be in there. When this whole flap took on, the administrative codes actually got a bit perverted, and that all of a sudden, the regional health officer can only perform for us for 2 weeks. And our regional health officer was kind enough to do it for, I think, 3 times that long, for 6 weeks or so. So the picture I'm trying to paint to you is that the goalposts move around depending on what people perceive as an objective. And that's always true, but if it's from an RCW to an administrative code, there can be a lot of noise in there. And we mustn't violate the RCW, but the administrative codes, we should not hesitate to question them. Are they really a reflection of common sense and what should happen? What should happen in this case is fairly clear. We need a health officer that we feel comfortable and understands our needs.
Yeah. You know, I share some of the concerns that you only have one person. You always like a deal, and I'll just give you a little perspective, what I'm always looking for. I think our role is to always look for the person that does the job better than whoever's there. The person in the role, their job is to make sure I can't find that person.
Yeah.
So that's how I look at any of these contracts, is I'm always looking for, how do we do it better? Their job is to make sure I can't find a place to do it better. So I think there's really 2 distinct roles. And I think as long as Dr. Krager understands, and I'm sure he does, that I'm always looking for the person that can replace him and do the job better. His job is to make sure I can't find that person. And I look at that in any position we have here at the county and where I was before. So just that little perspective on there.
Yeah, if I could comment on that, there is always a hysteresis in something. So it's not like tomorrow somebody says, oh, there's somebody faster 6-shooter than this guy, and so we will change. No, there's just got to be a slow filtering process where you assess things over a longer period of time and with more meaningful metrics. And we lack a lot of meaningful metrics in a lot of what we're forced into doing. So for this case, how this ties in, I would recommend an annual contract with the confidence that a good job begets another contract, but I also do not assume that in this case, that the health officer is our prisoner. We have to please the health officer as much as the health officer has to please us. So we're not trying to capture anybody and hold them prisoner.
Well, and I just want to say too that this is a little off the subject, but I appreciate this whole process because I've learned a lot about the health officer, how they function, what happens when there isn't one. And it's really, I think, been a real good education for myself. And it really makes me feel good to have had a chance to get to know Dr. Krager more as a separate entity from the other person involved. And I think that helps us focus more on what he believes and how we can talk to him directly. And I do appreciate that whole process, and I appreciate the public. If you all support it, I appreciate that. But I'm in favor of Dr. Krager.
Gina?
I just wanted to add, I know it is a very unique role to have a health officer. It creates an interesting dynamic. And we work closely at the department with Dr. Krager. We have, going through this whole process, and we really appreciate the thoughtfulness of this board and the involvement from everyone as we moved through this. We put together, we have just like an informational page if anyone's interested, just to try to help summarize the role of the health officer and how it interacts with our department. So, local health departments are authorized to do what they do under the authority of a health officer. And so it is much more than like birth and death certificates. It's, responding to solid waste complaints, issuing septic permits, food, restaurant inspections. It's a lot more. All of those pieces happen under the authority of the health officer. So it is a lot more, but we did hear the most about the birth and death certificates because that's our biggest customer service piece. That's where we see the foot traffic in our lobby the most. So that was the piece we were really concerned about. But if anyone's
If
interested,
you
I
wouldn't
have.
mind, I'd like to drill into that. That seems a bit odd to me. We operate all under the governor, if you will. The governor hasn't met with us at all. Do we count the governor? My point being is HHS has functions. The health officer is not it's not a legislative entity. The legislature is. So there's some pretty clean roles there. I am surprised, certainly based on the numbers I've heard of the amount of time it takes to be a health officer, that there's even a time that you'd even mention the EHU or something like that, the Environmental Health Unit. Those I see, and this is part of what I was starting to talk about, those are your job and not the health officers.
Right, but it's under the authority of the health officer that sort of gives us that ability to enforce, like, when there's solid waste issues, for example. We wouldn't have any authority to do anything about it without that health officer structure. And that's in statute. So there is a lot of those pieces that when you start really drilling in, that a lot of our functions that we do happen under the authority of the health officer. We do them, we carry out the duties, a lot of those, the day-to-day roles, but it happens under that authority.
I think both state law and county policy has language with regard to solid waste that is exactly what you described. Under the authority of the health officer,
Mhm.
the department will do such and such and such and such. So
Yeah.
Yeah.
What-
that's kind of interesting because you don't normally associate the health officer with garbage, but
But it leads to some really interesting things. What happens if the health officer doesn't agree with the regional health officer? So the picture I'm trying to paint to you is that we've got a dummy organization going on. And whenever you have a dummy organization on, it diminishes the human value of an assessment or the assessment capabilities of a human, because they say, I'm just responding to the boss. And I'm really bothered by this, but there's nothing we can really do about it.
Yeah. I agree. And this has not, I'm okay with this resolution, but what you bring up a point that if anybody has listened to me at any time at all and knows, I really have issue with unelected people being given power to control the public. And so that kind of stuff drives me crazy because they can't reach out and touch them if they don't like it. And I think that's wrong. And a lot of times what that has to do is because politicians elected don't want to make some of these tough decisions. So they pawn it off and say, well, that's what it says. You got to do that. And I disagree with that whole concept, but I'm not talking about this resolution. I'm okay with your resolution.
Sure, appreciate
Yeah.
that. And I think, you know, that it makes, it's really important then for this body to have good relationship with our health officer. And that's why I think we appreciate the thoughtfulness and this process and how, you know, making sure that we're really thinking about how we move forward with our health officer, because we want to make sure that there's good relationship there because of that piece of, you know, this body is the group with several elected officials that get to have say in that. So, yeah.
I'd just like to add too, I'd like to defend the board because what Commissioner Mortensen said is at the beginning, when we were without a health officer for a brief period, there was lots of things going on in the papers and online. In fact, we received some letters to the board that I believe were fake letters of people complaining that they couldn't get certificates. And the truth is that HHS was only 2 days, I believe, behind.
It was because of the way the system, we had to get back into the system. So it ended up being that whole week we weren't able to process those items.
So 5 days, but which is still far ahead of any other, of most other counties. King County takes a lot longer than that. So there was really, the people were yelling, the sky is falling, and the truth was that it wasn't. It was under control, and I think you guys, I thank you for doing a good job and getting it back on track quickly. And
Also, the public should know that they were never held hostage by this. If there was a copy of a death certificate they required, they could get that from the state.
or just going down to Clark County. So,
Jen, do you have a copy of that, copies of the responsibilities of the health officer that you can share?
Yes.
Thank you.
so
You need a resolution?
yeah, I'd entertain a motion to accept this resolution. Just for the public clarification, this resolution is going to basically recommend to the Board of County Commissioners to hire Dr. Krager as our health officer, and the terms of his employment and service will be
Thanks, Gina.
determined by the Board of Commissioners.
I would make that
And by
motion.
Dr. Krager,
Sorry?
and by Dr. Krager.
And
Yeah,
Dr. Krager.
yeah.
I gotta agree.
Well, I think we need to be very careful. I don't believe we can set a term. Right? I mean, we can't, it's not a 1-year contract or a 2-year contract.
I think,
What do you
think
do?
you can. The last one was termed,
It
had a
had
term.
term.
Last one had a 3-year
It
term
came
on
up
it.
on
Yeah.
December.
So I think it's up to the Board of Commissioners to set that, and I believe that any kind of a public servant should have a term limit.
Check the ordinance. I think the law is a little bit different and unique for that, so. But nevertheless,
Yeah,
there's
I think
also,
there
there's
has to-
also a way we can terminate.
sure. But I don't think they're appointed for life.
There's some curious ramifications there. If we decide not to pay Dr. Krager, after a year, he's forced to stay on the job because he's the appointed health officer. I thought we solved that problem long ago.
Well, with all that said, I'd make a motion to approve this resolution, suggesting to the BOCC that we hire Dr. Krager or work out a contract or schedule, whatever you want to call it, with Dr. Krager.
So a motion on the floor to accept this resolution for Dr. Krager as the health officer. Is there any further discussion? Any hands or anything? Okay,
Not seeing any.
sure. We got a little extra time, so
Thank you for letting me see this. because I'm part of the public and I really don't know what a health officer, his role is. And so this is a good guideline. But I noticed here, his has powers and duties. Okay. Basically, they're very nicely aggressive. No, I shouldn't say nicely. My worry, and of course, everybody, I'm an older lady that has worries. There's nothing here that says he has restrictions on these powers. Okay, which doesn't probably, it sounds rather silly. I agree. However, he is now the regional health officer. Does he supersede if our local health officer says, okay, we have an Ebola outbreak, does the regional say, well, no, you're wrong? Or can he say, no, you're wrong? I will take over, or my word says that, yes, you do. And does he have more power than our local one, for one? And
That's a good question.
Good question.
and then again, if does the regional, of course, he has his powers above him as well. I understand. So basically, and I know this sounds really silly, but I've seen it happen with the mask and the mandates for shots, okay? Where a state official will get this bright idea that we all need to do such and such to be safe, as in the mask, okay? And everybody had to wear it. And the health officer, of course, would be responsible to making sure, that this was happening. He has to follow what the state says then, if I get it right. He has no real control of our county. He can't say, no, I don't agree with the regional or whoever's above him, correct?
If there's a statewide mandate, that does get really hard. What we can do locally is advocate for what's best for our community. That does get really tricky when there's a statewide mandate. Our local health officer then doesn't, his powers and duties don't supersede a statewide.
That's, okay, that was the
Mandate.
question.
Yeah.
And then, so let's just say that one day he wakes up and he thinks that we have a real issue with restaurants spreading a disease. Does he have the power to close a great deal of our businesses with that idea? I mean,
Are you
He has to
referring
have-
to the regional or our local?
our local,
Yeah,
I'm
he
sorry,
does.
our local. I mean, how much power does he have? Does he have, what if he does close down a string of businesses, whatever it may be? Can we, as a community or as the board, can they protest and say, well, wait a minute, we don't agree with that thought?
Yeah, I mean, it would be a really extreme situation, I would imagine, especially for our local health officer to consider taking a step like that. It hasn't happened for us locally. I don't know, in a very long time, or if I even can think of one since I've been here, but it would be a really, really extreme
Okay.
situation, in which case we would have, communication with the Board of Health about what's going on and what's happening. And
If I could interfere in that, Mr. Chairman, it's a very good question. That answer I've heard before from places like Department of Ecology that says we want to pass a rule that you put meters on wells. And when somebody objects, he says, don't worry about it, because go ahead and pass it, because we don't have the ability to enforce it. It's the same way, there are no constraints, like you mentioned, there are no restraints on this. This is not a good thing.
Yeah.
This is something that the Board of Health should discuss in general. But while I have the microphone, in the Q&A, both Mary Jane and Dennis, the comment is they can't hear you properly.
Oh.
What you're pointing out is just not here. This pervasive, we have a building commission in the state of Washington that decides building code for the whole state. We have a Department of Ecology that just issued new septic rules that when they take effect, they're probably, when I talk to the septic guys, probably gonna add at least 20 grand to the deal with that. we have a state that wants to control
Yes.
everything, and they have these little,
Yes.
their little commissions and their deal, and this is no different, where they give them all these authorities, and that's what I tell you, I have issue with.
Well,
But-
I have that.
But we see it here, we see it in building, we see it all across the state.
Well, I appreciate you saying that because I have a real fear. I know everybody says this over and over again, that it's over 50. Well, actually, maybe even over. But you see more control every year, it's not a one-time thing. It's a creeping evil disease that's happening where, and no offense to you guys or doctor, and I'm sure he's going to be great. He's just going to be great. It's just that I worry about the amount of power that he might have and he might use, but I'm sure he would use it wisely. But his successor might not, and he would be under the same thing. I don't like the state having that control. Thank you.
If
Flo-
I
I
could-
don't either.
Flo, could I just ask, Dr. Krieger, would you like to give us any input on any of these questions? You
Be-
don't have to.
Before you do that, let me say, I've seen Dr. Krager in action and he is not inclined to be the tyrant that this document
No, I agree.
permits him to be.
I agree, but I think
Yeah.
he might want to say that or
I'm happy
share
to,
that.
I'm happy to say that. So yeah, this is Dr. Steve Kreger. Two things I would say is just regarding kind of the statewide powers. I mean, I view my role, if I'm appointed as the, not, maybe not permanent, but not the interim health officer, to advocate for Cowlitz County. So while, yes, we do have to follow, state law. I want to have like a finger on the pulse of the community and advocate for what's best. I think second of all, in regards to just, whether I would kind of overstep powers and duties, ultimately I report to this board. So if I do something that the board disagrees with, you can fire me. So I think that is a check on that, the health officer power is quite broad, but there's a check on that power.
I'm just
And
gonna,
I also, I remember in the midst of the previous difficulties, there was discretion that you exercised kind of, you weren't coming down with a heavy hand. It was the state officials that came in and interfered with our lives and incorrectly, in my opinion, and we advocated as best we can. So I appreciated your sensitivity to us. It had a lot of bad stuff that happened, and we hope that doesn't happen again. And I think you're the right person to be able to be the intermediary as best we can.
Well, and I just want to, I know Bill wants to say something, but I wanted to just say I had an experience with you when the monkeypox came down and we were waiting for big headlines and shutdowns and pandemic kinds of attitudes. And I went in and talked with Dr. Krager and he said, no, there isn't any need to do that. Can I use your word? I mean, I can't quote you, but he said, I don't see that as being a problem. It doesn't seem to appear to be an issue and we're going to just kind of watch it and see what it does. And he had a reasonable response and I felt real comfortable with the way he responded. So that's how my experience has been.
and I just add that it took me a minute to find it. But the RCW, the first sentence of the local health officer powers and duties says that the local health officer acts under the direction of the local board of health. So there's a check and a balance there.
Yes.
Did you have something about just this resolution? Because I'd like to move on with the resolution, then we'll open it up. But if it's regarding the health officer position?
Are you talking to me?
Yes.
No, I'm going to wait, but I
Oh,
will shut
okay.
up.
Okay,
I'm
that's
gonna
fine.
wait.
So, if there's any further discussion on this resolution? So the motion on the floor is to approve this resolution to appoint Dr. Krager as our, local health officer. All in favor? Say aye.
Aye.
Any opposed? Looks like no. So that's a unanimous. And thank you very much, Dr. Krager. Thank you also for your
you.
help during the interim period. It was very appreciated.
Of course.
So that goes on to the Board of Commissioners to work out the contract. Next item is. No, it's okay. We're going to talk a little bit about the budget. So the budget has already been approved for this year. I believe we'll have to go through a budget approval process again later this year, at the end of this year. And I just open the floor to board members if you have any comments on the budget.
Was it 1 year, Gene, or we do a 2-year budget cycle?
2.
Oh, okay,
Yeah.
my mistake. Then it'll be good. Got an extra year to hash it out.
I think most, if not all, your budget comes from state funding. Is that correct?
Primarily state, a tiny bit of federal, and then our fees and permit fees and et cetera.
Come through the county.
Mhm.
So basically what we're approving is any change in the fees and permits. The rest of it's kind of, I mean, we can adjust how many people we want, but the funding actually comes from the state.
We get it's sort of a set base funding to help fund our, some of our obligations like communicable disease activity, work, stuff like that. And then our permits and things help fund that type, the environmental health type work as well. In addition, I know we've talked briefly about this before. We've received in the last few years the foundational public health funding that we've not really, we get it and then we give a large portion of it back is what happened last year. So that's a pot of money that we could have further discussion on if there's priority areas that the board is interested in doing additional work in locally. We could look at that and we may be able to utilize some of that funding for some additional work.
Okay.
Do you get that annually? The
Yes.
foundational? Okay.
Yes.
I would be interested in talking more about how we could use those funds for the county. I'm familiar with those funds, having received them through the tribe as
Mhm.
well, and they've been really useful for building some of our foundational public health services. And I know that they're very flexible and in my head, there's a use for them for a community health assessment, but I think there's a lot of ways to go. So we could definitely, that would be a conversation I'd love to have with the board and with the department to see how we could utilize those instead of it going back and being given out to other counties instead of our own.
How much do those funds generally, how much is offered to the county?
Carol's better with the numbers.
Good morning, Carol Harrison, Director of Health and Human Services. Our foundational public health services, I believe this year, it's 1.4 million for the year.
And that's
and
for 2024, I'm sorry.
It would be July 1, 2023 to June 30, 2024. And at this point, I think we are only set to spend about less than 300,000 of that. So it leaves about 1.1 million still available if we had special projects or doing community health improvement projects or community health assessment work.
Are there priorities the department has identified for those funds that would be useful? Or are you wanting the Board of Health to provide that guidance, I guess?
Good question.
I think it would be great to come up with those priorities together. We have some ideas in terms of, we'd love to do a little bit more around chronic disease prevention and some things like that, prevention with youth and some things like that. But it would be great to have some of those discussions with the board and see if there are certain priority areas that we could focus on and strategies that we could agree on to move forward with.
So do you have until the end of June to request those funds at 1.1, or is that money that's sitting in your checking account?
It's literally sitting in our checking account. We invest it heavily, so we get a profit off of it, so to speak. We do get interest earnings, and so there's about $1 million sitting in there just from that. We do write a check, literally, in July or August, and it goes back what we don't spend. So then we uninvest it and return it back to the state.
What about the notion of having staff put together, because you said that you guys have some ideas, your priorities, presenting them to us at the next meeting, and then this board do the same thing and see where they perhaps might line up and attach some dollars? Because if you're talking about, a community assessment, what is that, something like that cost? And what was the other thing you mentioned? Chronic disease,
Chronic disease prevention.
yeah.
Yeah, I'd like to comment on that. I think Alyssa's question is a very good question. My answer to that would be slightly different. I think it's, while I really like teamwork and I think we are all assumed to be rational and we ought to be able to work together and come up with something, but essentially it's the Board of Health's decision as to what things we go after.
I think one of the priorities that we talked about last year, but we never quite got into it, would be youth prevention, youth abuse prevention. That I'm talking about vaping, alcohol, drug prevention. Today, we were supposed to have a speaker come talk about that a little bit, but I have some ideas on the youth prevention that we can do to go into schools. From what I understand is there's only one assembly per year in our county that only invites 200 kids from all the schools, and that's a one-time deal per year. Lindy attended that and spoke about it, I think, a couple months ago. They're doing, it seems to be doing a good job, but I don't know if that's enough. So I think one of the priorities would be, since drugs and alcohol, the drug court, there's all kinds of different things have been discussed, should be focused on the youth and trying to prevent them.
But Mr. Chairman, if I could push you up, I think Alyssa wanted to comment specifically about kind of the process, not the specific of that. So you were,
I'm just offering that as, that could be one of the priorities.
I know, but there is also peace.
Yeah.
So is it correct that the Board of Health is really the one that should give HHS its sort of marching orders that might be optional beyond what the RCW requires?
I think I would agree with that. And then I would just ask for their input, what they are seeing as well.
Of
And then
course.
maybe we can come up with a list.
But what I'm trying to do is avoid to have unelected group decide how they're going to go about things. And we are essentially the elected group.
I agree. I'd say that, yeah, to get some input from them, and we have talked a few times about different priorities, but to come up with a list, I think that's a good idea.
Yeah, I think Mary Jane had the right idea, personally.
I guess I would like to know from the department in terms of actually implementing these priorities, since we do have a deadline for spending the money and getting it used in a way that's wise. What timeline we're looking at for getting you those priorities and having you have the capacity to take those priorities and turn them into actual actions, because although we can come up with generalities, we're not the ones that are going to do the actual work of getting that money spent and done. So, and yes, if it's our priorities, I'm fine with that, with input from the department, because you guys are the ones with boots on the ground, and I'd like to hear where you're seeing issues as well.
So it seems to me that now that we have a health officer, we need to coordinate through him what his recommendations are. It's not like he's brand new to the county. He's been working the issues for quite some time. Perhaps we might want to use the next 4 or 5 months to prepare for next year based on his recommendations, based on how we get the data, make sure it's data-driven rather than headline-driven. And, we've got some time if we just say, this year's already set, but next year we can make a difference because we do have budget amendments for the second year of the biennium, so. I don't want to leave the health officer out.
Yeah,
and,
of course.
Take
I've-
advantage of his expertise.
But it would be a shame to return money to the state that the county could use if we could come up with a priority to use it for within a reasonable time without feeling rushed or crazy or leaving the health officer out. But I mean, what a shame to have 1.4 million that we could use to improve the health of our constituents, which we're all interested in, and return it to be used by other counties or the state itself.
The only argument I have with that is too often we say spend the money and we assume that we'll get good results out of it. And we really should think about proving everything that we claim. So if we're going to spend, I agree with you, let's not send 1.4 out if we know that we can do something very useful with it here. And the knowing is the very tough part. And the reason I say that is we all are very familiar with all the hazards of all kinds of things like STDs, and yet we still have it. Fentanyl overdoses, we still have them. We haven't cracked how to spend that 1.4 to bring those numbers down, maybe
Karen,
except through advertisement.
The money has to be spent by the end of June. And I guess that kind of following up with Alyssa and Dennis, is there anything in the queue that that you guys and the health officer believe would be helpful to support the county's health that is fairly ready to go? And I mean, I don't know what your workload and what your visions are.
We can certainly look at timelines. As we work with the health officer and maybe identify some of our priorities, we can look at what we may be able to do realistically to try to spend some of that before the end of the year. It would be, one time supporting a project here, little types of things, but we could certainly consider that timeline and be able to identify what we could do before the end of the year versus what might be longer term strategies.
And then I guess, I'm sorry, I guess but it makes sense to continue to move forward with you guys and the health officer looking at your priorities for the next fiscal year's funding to
Okay.
get those queued up and priced out, I guess.
And there's nothing to, correct me if I'm wrong, but there's nothing to say we couldn't start a project that seems like a priority and a good, wise use of funds now with some of these funds, like you said, knowing that we're getting additional foundational public health dollars in the next fiscal year. Therefore, we could continue that work. So it doesn't necessarily have to be work that starts at that fiscal year period. We could take our time, identify priorities, knowing that we have the funds now and the funds in the future, correct?
Correct.
Okay.
May repeat, I'm a little nervous about this. I think Commissioner Weber actually hit the proper suggestion is mostly what's done now, dice has been cast. Let's use the time profitably in the future. I am finding that in many instances, if there are funds available, all of a sudden we've got to find a problem. Look, problems find us without us having to go find the problems. So let's not step too fast there.
I don't think it's about stepping fast. If we know this money's here and it's coming in the future, I don't know why we have to align our discussion of these priorities with the budget cycle if those funds are there and we know that they're coming and they're unobligated and unspent, I guess. I'm confused about why we can't just continue this conversation until we've identified how to use those funds in a good way.
Oh, always we should do exactly continue, but to say that we must come to a decision by June that will consume the 1.4 is the emphasis I'm trying to
Okay.
take
No,
away.
I agree. I don't think we should be like, let's just spend the money. But I think because we know that money's there and we can even start to spend part of it, knowing that it's going to continue on, it would be a good discussion because we all know there's priorities that could use this funding. And I'd be I think that would be a very good use of this board's time to discuss what that means, and what that looks like.
So when we talk about making data-driven decisions, there's two aspects to that. That is the data that explains what are the health concerns and health problems, the challenges facing people in their everyday lives. But the other bit of the data that's much more difficult to get our heads around is the proper process for getting those problems managed. We're not going to eliminate a lot of those things, but we can manage. There's a lot of, I always hear evidence-based procedures or programs. And we need to make sure that we figure out programs that work, not because they see X number of people. That's not a success measure in my book, but something that actually changes behaviors in the long run. Again, very difficult to change. I mean, there's a reason why we still have a problem with alcoholism. It's extremely difficult to get that under good management, but we need to be aware of that. Not only what does the data say are our most serious health issues, and what does the data say are the programs that actually work, and make sure it fits Cowlitz County. So daunting task, really.
Mr. Morris?
I'd like to add, we sort of treat, it is just a general picture. When we look at the money that we are reluctant to send back, realize that we are individually in this nation in just a national debt, $100,000 in the hole. And it's growing at 3% a year. So the typical family of four means that they owe $400,000. This money that we're using to solve problems that we're trying to find may not, it doesn't exist except in the slavery of the future generation, if you will. So we ought to think about this as not only is there a would be nice problem, but is it a problem that we can solve and should be solved? Otherwise, we're just a part of the community that says free money and let's go headlong into the cliff.
I think maybe we should, a good solution could be to have a workshop meeting about possible uses. And then I would also like to say that now that we have Alyssa as the new tribal representative on our board, I'd like to know what the tribes are in need of. And I'd like to see if we could meet with the tribal leaders, the elders of the tribe. Is that something you can arrange? Because they are part of Cowlitz County. And I think that the tribe has not been mentioned yet. And I think that we should talk with them as well.
I can certainly reach out to tribal leadership and see how they would like to engage with the board and the county on these issues. I can't guarantee a certain format or a certain audience for that, but I can reach out to tribal leadership and see
Yeah, I think
what their
that,
priorities around public.
I think it would be important to have them come to one of our meetings possibly.
From my understanding, the tribe already has a pretty well-developed series of clinics, but it's statewide. It's not necessarily located here, but they have, through the federal funding, I think they get quite a bit of money to do both behavioral health as well as
Well,
physical.
maybe we can learn something from the tribes
Yeah.
too.
And what is the point of you being on the board if you don't feel there's a connection between Cowlitz County? Or I'm not saying
that's
there
fine.
isn't one, but
No, I'm not
I'm-
saying that. No, I
Oh.
think that's why I am on here. And I'm saying I'd
Good,
be happy to
good.
reach out to tribal
Great.
leadership to
yeah,
see what, like, I'm a representative. I don't speak, without
no.
consulting with tribal leadership. I wouldn't feel comfortable saying what their public health priorities are.
Yeah.
But that is why I'm here, because I think there is a connection between county public health and tribal public health. And yes, we do have a number of, Cowlitz Tribe has a Health and Human Services Department that has, a number of services, both within kind of direct medical care, behavioral health care, substance use disorder. as well as more like public health focused initiatives. And our services do run from down in Vancouver up to Tukwila. And obviously we have tribal members throughout Southwest Washington and the country. So yeah, I'd be happy to see for Cowlitz County specifically what some of those health priorities are. And I was just saying, I can't guarantee like who would be involved with that discussion and stuff, but I can happy to be the representative that I'm here to be and talk to the tribe about that.
Great.
Yeah, I think that having them come talk to us and learning, maybe they could teach us something, maybe we can understand their needs better. And I think that's better for the whole county.
I don't want to lose sight of the fact that we have a Health and Human Services Department here that faces all kinds of problems, health issues in the community every day, and a health officer who does the same thing. So I don't want to lose sight of the fact that our local expertise is important. The tribe makes sense to see how they're managing their projects, but you guys are the folks that are on the street every day, working with the public to see what's going on.
So I'm going to ask the clerk to share a meme. You did receive it? Yeah, and the point is, I think Commissioner Weber's made good suggestions, Alyssa's made a good suggestion. We should continue working along. But we have to remember something that Groucho Marx was able to do, and it's right up there on the screen. Unfortunately, we're involved in politics, and we've got all these grandiose ideas, but please let us use this board effectively, not politically play games and grab free money.
Yeah, I'm glad you put that up because Groucho Marx came to my mind, and just for the people who can't see it, politics is the art of looking for trouble, finding it everywhere, diagnosing it incorrectly, and applying the wrong remedies. So it doesn't scare me personally if there's money there that has not been used.
Right, we have to answer questions like, we are reported to have good health or bad health, depending on whose article you read, but we spend more on health than any other nation in the world, as best as I can tell, and yet we're told our results are dismal, our quality of life is dismal, and so forth. I don't want to do something that exacerbates the problem.
So I'd like to, we'll table this discussion or continue this discussion, possibly in a workshop type of meeting. And if there's no objection, I'd like to open up to public comments. They've been waiting patiently. And thank you, Carol and Gina, for your input. And thank you, Dr. Krager, again. So we'll now open it up for public comment.
Buddy, thank you.
Thank
Chairman.
you.
I'm going to be very brief. Just want to do some comments. I wasn't able to make it last.
Pull your
Can you-
microphone.
Is it right? Sorry, I have a habit of
There we
doing
go.
that. And so I just want to show, here is my plaque for service to the Board of Nursing in Oregon. So I actually was a care provider at one time. And here are some books. This is by Judy Mikovits. She was persecuted for coming out as a whistleblower years ago about how badly the AIDS crisis was handled. She was a research scientist who developed a lot of treatments and study on that subject as well as on others. She's very well thought of in a lot of circles. Here is a book by Dr. Charles Atlas, who talks about the mistakes that were made during the Trump White House. Not that Trump did them, that there was a lot of politicization of the COVID response that he tried to circumvent with common sense and was stalled by Dr. Birx and Fauci. Thank you. And this book is by Robert Kennedy Jr. It has 2,000 plus annotations, very carefully researched and very carefully documented. And the media tries to portray him as a nutcase. He's actually a brilliant lawyer and worthy of consideration. And this book is by a gentleman who worked for BlackRock as a trends analysis. In order to do that, you have to have a really high IQ and very good pattern recognition. He was tasked by them with finding out what was happening in markets and making the right response with investments. He ended up looking at excess deaths in 21, 22, and 23 and saying there were no excess deaths in 20 and 19, making that this was not the pandemic they were making it out to be. And he was able to correlate this to the vaccine rollout. It's a very important book, and it's not by a lightweight. And I'm going to read my comments. I had heard that some of you had asked what my credentials were, and I will say the credential class has been proven to be wrong more than right, censorious and vindictive and downright fraudulent. The last people I want to hear from anymore are experts. I'm not presenting myself as an expert. I am presenting myself as a citizen who doesn't want your fear or authoritarian impulses to inhibit or restrict my freedom of choice medically. If you still trust the experts, after 3 years of lies and fear mongering, go ahead, but I'm done. And what is my background? I've had over 500 hours of undergrad study and a bit of upper division. I'm an autodidact, which is a fancy way of saying I learn easy. I have over 4 years of chem, 3 years of human phys and anatomy, 1 year of biology, 3 years of psych in upper division math and statistics, as well as innumerable hours in the humanities. I have worked in healthcare settings for over 35 years, 32 with one employer. I have no credentials to caregive anymore. I'm retired. View me as a 7th grader presenting a book report, or none of the data is mine. It has been gleaned from my research of medical papers, news reports, legal proceedings, and publications, and it stands on its own merits. Key takeaways from what I have put on the record earlier. Fauci admitted masks don't work. He admitted the 6-foot distance was fabricated and that the vax did not do what was promised. Francis Collins, former of the NIH, admitted the lockdowns were a disaster. He was Fauci's boss. Dr. Deborah Birx, that was the scarf lady during the Trump administration, admitted she lied to President Trump to get her way. She misrepresented the risks to induce stricter measures which were destructive and futile. The inventor of the mRNA technology has warned it is harmful. Dr. Malone has come out fervently against the vaccine and himself was vaccine injured. Johns Hopkins study revealed the lockdowns were harmful and not effective whatsoever. The Cochrane Medical Review Group and Brown University both concluded that masking was ineffective and harmful, especially to children. They found microplastics in people's lungs and also developmental delay on kids.
What did you say they found in children's lungs? Could you use your
But
microphone?
in everybody's lungs,
Bring it down
they
right.
found microplastics in lungs from having the mask on all the time and developmental delay in children. Serious
Microplastics.
developmental delay.
Okay. Thank
The
you.
inventor of the PCR test warned it is not a diagnostic tool. Medical research studies show that 5% of doses were deadly, signaling a needed halt. Japan refused to distribute the vaccines when impurities were found. The virus looks like it did come from a lab after all, and they knew it immediately, but lied to you. The FDA admitted they exceeded authority when they forbade and ridiculed ivermectin, which has now been shown to have a low risk profile and very good results. What more do you need to realize that freedom of choice is necessary and proper? Thank you for your time.
Thank
Thank you,
you.
Bill.
Thank you for your comments.
Does the board want a copy of the bibliography?
Sure.
Yeah. I would,
Yeah, let's put that in the can we put it in the record? Or?
there's also a movie, The Real Anthony Fauci has also been made into a documentary movie that was,
And it's right.
please.
One of the biggest problems with government programs, and I'm quoting somebody, and I can't remember where I read this, is judging a program based on its intentions rather than its results. And so, with that comment, I want to tell you that in high school, some of the programs that I remember as going through high school, some of the assemblies that came through were extremely impressive. I remember them to this day. I can't believe that, maybe I naively believe there's some type of a national assembly organization for high school age kids or middle-aged kids that you could probably access with the snap of your fingers by just making the right phone call. And with the drug problem, in the top of my mind, the worst thing that we're facing today is drugs and addiction problems, alcohol, tobacco, et cetera. I can't believe that you can't get your hands on a program or two that you could get between now and the end of this school year, since the money's gonna go away just about the same time the school year ends, that you're gonna lose it. I would think that you could get a program into the high schools on a countywide basis. How many high schools are in the damn county? I don't know, 6? I don't know off the top of my head, but I gotta believe that somewhere, even on a short-term notice, you could get some very good programs in front of kids before they get out of high school and emphasize to them the dangers that they face in life, not only with addiction to tobacco and alcohol, but with the drug problem we have in this country right now, with the illegal drugs coming in and the fentanyl deaths that we're facing, which are just astronomically unbelievable to me. But I see the numbers in the hundreds a day that are dying. These are our future generations of this country. And I would tell you, one program I remember seeing that had not only a wonderful speaker, but had some very vivid images that at the time, you had almost thought they were taboo to show those types of pictures and images on the screen, especially to high school kids. But today, I would tell you, I would show a complete autopsy of a teenager on video to high school kids. After this kid died of a drug overdose, this is what he's gonna go through. This is what they do to his body to figure out what the problem was. Do you want to be that kid? And I'd put that in front of them in very vivid color, full screen blow up and say, you know, I'd explain to them ahead of time, if this type of stuff bothers you, you might want to cover your eyes, just like they do with movies, sex, violence, drugs, They put a warning out there, whatever it is. But get it in front of kids and make it as vividly real as possible to get the message across, scare the hell out of them, and get them to understand what the risks are. Do you want to be this kid? That's all I gotta say.
Actually, I like that. If that is something that can be done, a good professional job will have an impact, I'm sure, but
Ron, I've been personally trying to talk to different groups about exactly that, because I feel the same way you do, that it made an impact on me on the different assemblies, Mad Mothers for Mad Drunken Driving, whatever. It made an impact. There's some resistance. I'm not sure why, but I don't know if it's the schools that don't want to take the time for assemblies, but I approached someone in the area about this, and it was an administrator at a school, and he said, nah, we don't have time, or we just aren't, we have too much to do. And I got a real negative response. And so I went to the care coalitions who are going to come and talk to us. And I would like us to maybe have the public say something to them, because I've talked to them a little bit about it. Care coalitions are going to explain what they are, but they're through the ESD, and they're for prevention, youth prevention issues, programs in the schools. Every school has one. And the thing is, they would be a key player if we could get them to participate with us. And I don't know if we can, but they have money, and I think Cowlitz County, I was going to ask Cowlitz County about, they have a little pot of money, I heard one day, that was up here that wasn't being used, and I didn't know if that was accessible.
You're looking at me, I have it stored
Well,
away
I
somewhere.
don't, well, anyway, I agree with you, Steve. I think we need those assemblies, but there's some resistance, and I haven't quite figured out what it is and why. And so I think that might be something that we need to explore. Mary Jane, do you have any thoughts on that? You get into the community quite a bit.
So I think that everybody, my sense is that it's a little bit, unstructured and unorganized. Everybody's building their own, hierarchy without collaborating very well together. So there's a lot of, people falling over each other to try to do something like that.
Do you know any groups that are thinking about assemblies for that kind of thing?
For assemblies, Link, I don't know that they do assemblies, Youth and Family Link, but they're very connected to the community and they work with the schools.
You're
And I believe countywide.
Can I just say something real quick when we're talking about intention versus results? I think there was also a comment in the public chat that kind of reflects my understanding of the issue, which is that a lot of these scare tactics have actually shown that they're not really effective for the majority of folks, that there are other tactics that have proven more effective for drug abuse prevention. So I'm all on board for youth drug abuse prevention, don't get me wrong, but I want to make sure that what we're doing, as we've all discussed here, is an effective way to approach that. And so I think scare tactics in public health, my understanding, which is very basic, and I don't want to get too much into the weeds here, is that scare tactics work really well for very short-term behavior change, but for long-term doesn't always work unless there is some type of other social supports and things in place. And so I would like to delve more into that to make sure that whatever we do choose to use that money for drug abuse prevention is effective and works for our community.
Well, I think there's been a lot of classroom drug prevention programs from what I hear from students that currently are in them. And they don't seem very impressed or affected by it is the problem, is what I've been told by a freshman, a couple of different students, that they just don't take it very seriously the way it's being presented, although it's very professionally done and well done, and I'm sure it's data-driven. But it doesn't seem to, we still have a huge problem. So I don't know what the answer is.
Well, I'm going to say that if scare tactics don't work, let's say that out
Sure
of
worked for me.
100 people, 60 of them don't remember it day after tomorrow. But if 40 of them do, if 4 out of 10 kids, scare tactics last the rest of their life, was it worth doing? I think, hell yes, it was worth doing.
Nothing seems to.
And if I had a school administrator tell me, we don't have time for that, I think I'd rip right into him and say, well, gee, great. How many people are you graduating from your school that can't do reading, writing, and arithmetic? You're not, don't have time to teach them the things they need to know. And now you don't need to trying to teach them to help them save their own life or maybe the life of a friend. Because sometimes that 1 out of 10 kids or 4 out of 10 kids, whatever that number is, that scare tactic works for, they'll be in the right place at the right time to save a friend's life or maybe a whole group of people's lives.
Well,
I
and the
happened to
answer,
be that kid one time.
and the answer to a lot of it is give them Narcan. That's been the go-to now, is just get your Narcan and everybody can die, overdose, and we can fix it. In the schools even, we're requiring Narcan. So I see this as a real public issue that we really need to push a little harder and look at the data, maybe some of the assemblies that they have around the country, and they could give us some information. I don't know where we would access that.
Yeah, I don't think Alyssa disagrees with you. She's saying.
No, I know.
That's, okay.
No,
because-
I don't feel disagreement, but I just feel that we've sat on this a long time and we're seeing no improvement as far as I can tell, as far as the drug problem. If anything, it's getting worse. And unless someone can show me some information that says differently.
What
I
a
just haven't
sad
read
situation where we're talking about, oh, by the way, let's have every kid put a Narcan in his backpack to
That's
try
gonna
and
be
save a
what
life
happens.
after they've overdosed,
Yeah,
rather than stop the
Prevent it.
overdose to begin with.
you can only do that so many times.
Yeah. And you read stories about people that they get Narcaned and they get revived and go right back into an overdose and get Narcaned again. Then they survive the second one and they no more than survive that, and get back on the street, and they're right back to doing the drugs again. And a repetitive process is just unbelievable to me. But when I read the information about how often that exists, what kind of a problem have we got civilization into? Our civilization. Okay.
An old adage was an ounce of prevention is equal to a pound of cure. And I do think that we need to focus on prevention.
Well,
Absolutely. Thank you.
a
Thank you for your
piece of the
comment.
problem in here is that the public generally doesn't trust the government. because we have shown that we will say anything to get whatever it is we want. So why should I believe you?
Why should we believe the classroom teachers? I'd rather do an assembly and have passion and not just a curriculum.
Please, go ahead.
Well, I gotta tell you, boy, all this talk just takes me down memory lane. They had a heck of a gosh darn drug program when I was in school, and I wish I could go back and watch a couple of those movies. I remember going into driver's ed and, we got to watch the movie Signal 32, where they actually showed the kids, got in a wreck, all drunk, dead, and it was like, couldn't wait to see it. You don't get to see dead people today, and nobody covered their eyes. I remember this one movie, I'm digressing a little bit. I didn't mean to talk about this part of it, but boy, this one movie I watched in 6th grade, I can still remember it. Boy, that was a great movie. And, kind of made me feel like doing it, to be honest with you. So, your compassion is really, really noted here. But I wanted to go back to the money part and the fact that, we have $1 million and we got to spend it kind of thing. And, this is something that I have experienced and seen through to the government. This idea that, well, we have this money, we have to spend it. And the fact is that what about if we acted like grown-ups, we funded our own stuff, and we didn't spend other people's money for all our high-flying ideas? I gotta be honest with you, and it's no slight on anybody here, but I have exactly zero confidence that you will solve any social issue, not just this one, but any social issue with a board of government. It's just the wrong place for this kind of stuff to be going on. And so that's my opinion on that one.
Thank you. We have a hand up that's been up for a bit. Who is that? Tom? Go ahead.
Can you hear me okay?
Yep.
Okay. On May 18th, 2020, when all of humanity was desperate for COVID-19 treatment options, former President Trump proudly declared he had been taking the anti-malaria drug hydroxychloroquine as a preventative measure, even though the Food and Drug Administration had already warned the drug could cause serious heart problems if used off-label on coronavirus patients. But as the former president was known to do, he ignored the FDA warning and said to the entire world, quote, "All I can tell you is so far I seem to be okay. I get a lot of tremendously positive news on the hydroxy. What do you have to lose?" End quote. And my apologies for the poor impression. Well, folks, we now know over 17,000 people died from taking hydroxychloroquine in the United States and 5 other countries that were part of a recent study of the drug's use during the pandemic. Donald Trump is literally responsible for killing thousands of Americans with his absurd rhetoric and devastating lies. It is simply gobsmacking how this board's leader and majority continue to not only ignore how wrong the former president and his acolytes were during the pandemic, but continue to endeavor gaslighting the public and rewriting history in a pathetic effort to absolve their enormous culpability and guilt. Enough with the endless stream of conspiracy theories and medical misinformation from charlatans like Bill Youngren, who just polluted the room with his absurdities. Respirators do work. Vaccines do save lives. And Dr. Anthony Fauci is a veritable hero to humanity. I have no doubt Commissioner Mortensen and his lackeys will continue their absurd crusade to gaslight the world, but they will never erase the fact Cowlitz County was the worst in the state for COVID deaths. For them to continue displaying not a shred of contrition or reverence over this terrible amount of loss is deeply immoral. Stop politicizing public health. Thank you very much. Be well, everyone.
I need to respond to that. Okay, that study he's referring to was a bogus study that was pulled and it was condemned for being absolutely set up. There, hydroxychloroquine has one of the best safety profiles of any drug. It's used routinely around the world for malaria. It has been used off-label for other things like lupus and you name it. It's not a dangerous drug. That is an absurd accusation. And when you have Fauci actually telling you they made mistakes, you've got Francis Collins telling you made mistakes. That's not conspiracy theory. That's them being contrite, not me. And they're the ones that politicized it, not the other. Thank you. My God. That's still enough.
I know I had read somewhere, and I believe it's the country of India, takes it on a weekly basis. They have a nickname for it. They take it every Sunday.
Mhm.
Uh, So I'm not
Well, I
sure.
just, for information, because of a medical condition I have, I've been subscribed and I've been taking hydroxychloroquine for years. And a considerable dose of it every day. And it's a prescribed medication. A certain side effect is a great benefit to me. And Mr. Samuel's comments are completely absurd that hydroxychloroquine has ever killed anybody that I know of. It has great side effects, and I'm personally somebody who benefits from it immensely.
Thank you for waiting. Sorry.
You bet. My name's Steve Rader, and this is actually the reason that I'm here this morning, unknowingly. I have been involved with youth for probably 25 years now. I've been a coach in Kalama and Kelso in wrestling and football and in baseball. I'm actively involved with youth in my church. We developed a program where we put youth through a challenge course at church for a week. And over the summer, and I've been doing that for 12 years now. I have put several thousands of youth through that program. And what we're talking about right now with regards to these kids, we're looking at addressing the symptom, and the problem truly is that these kids have there's an identity crisis going on. They do not know who they are. And what we do is I've been doing it for free. I do it for my church, and I did it on my spare time. I started a nonprofit organization for kids, Raiders Leadership and Outdoor Adventures. Because what I have found is that as we put these kids through these challenging obstacles and we make them do hard things and they go into a place mentally where they've never had to go because they're not challenged at school any longer. They're no longer, if their parents don't have the resources to put them into baseball or to put them into football or to participate in extracurricular activities, and they don't have a coach that challenges them to do more and to do better, then they go to the next place. And that is all these shiny little objects that society has created. And these kids go to the place that they feel welcome, to somebody who's going to make them feel a part of something that's bigger than themselves. And I've seen it over and over and over. With my church organization, I've been responsible for transient people within Cowlitz County. I'm the one that helps them whenever there's an issue. And in my conversations with them, 90% of the time I ask the question, how did you end up getting to where you're at right now? The response is, it was a series of bad decisions when I was in a dark place in my life. They don't know how to handle the stresses that life throws at them. And we're not preparing them for that in schools. So I got tired of seeing it over and over and over, and we're not addressing the real problem. The problem is these children need something that builds their hope, that gives them, you know what, I just went through a pretty challenging thing, and I did that. I accomplished something. Their self-value and their self-perception, if you go talk to youth today, their perception of themselves is based on their phone. How many likes can I get? How many people liked what I posted? That's fickle. That's not real. And the program that I have developed for these kids, and I would encourage all of you guys to meet with any of the kids that have been through that program. What I get from them is, this is my favorite part of the day. And I'm not easy on those kids. We make them do hard things. These challenges that we put them through are difficult things. But at the end of the day, they recognize I'm better than I thought I was. And then they have no interest in going to those people who offer them that quick fix. We really need to focus on helping our children deal with the stresses and the anxieties of life. That really is the bottom line, to help them do things that help them understand they can do hard things. It's okay, life's hard, and to prepare them for that and to not make it easy for them, because the drugs, the alcohol take away those stresses for a short period of time, and then it compounds the problem. And we keep talking about the drugs and the alcohol, and the reality is we need to help them gain an identity that they know who they are and that they can handle life and they can contribute positively. So I'm not asking for money. I have been self-funding that for 2 years now since I started that. But I am throwing it out there. I would like to have a conversation with any or all of you about that program and see what we can do to help push it forward to help the youth in our county.
Wow.
Thank you very much. I'd like to give you my card.
Oh, but before you go, in the Q&A, people have asked enough, maybe you could just repeat your organization and how they may contact you.
Sure. It's Raiders Leadership and Outdoor Adventures. We have a website. We're on social media. They can call me directly. My cell number is 360-957-3780.
Repeat that more slowly.
360-957-3780. And just so you guys know, I have been going to the Kelso School District and the Klamath School District and the Woodland School District. I teach the seniors. I do symposiums at LCC for the Kelso School District, teaching kids personal finance. I'm a financial consultant by trade, but I've taken that on because I see that there's a massive need for our youth today.
Yeah.
Yeah.
Those are great comments.
Yeah.
Thank you.
I think you point out, and totally on board, I think you point out one of the struggles that we always have. We end up treating a lot of symptoms and we don't treat the core. And I see that in a lot of areas and it's frustrating. So I'm glad you point that out. I think that's absolutely true. We see a symptom and want to fix the symptom. Well, a lot of times it's much deeper than that. And I applaud you for what you do.
I think it is a kind of combination of both too. I don't know if you can take away the drug education or those kind of things too, and just leave it to self-esteem. I mean, I think they kind of go, I think we need both, to be honest. But yours sounds great.
So I think we've run a little bit late, but I think we've had some good conversation here and a few possible action items. If anybody else on the board has any more comments? No? Without that, then I'd like to adjourn this meeting at 11:28. And thank you all for coming.
Take a short recess and then we'll start up.